Welcome back to AgriTalk, and we are in San Diego for the American Veterinary Medical Association. Some 8,500 to perhaps as many as 9,000 in attendance here in beautiful San Diego. We're very happy to have with us Dr. Rene Carlson, president of AVMA. She's from northern Wisconsin, and you tell me that's one of those few spots this year getting rain, right?
Yes, we've been very, very fortunate there, Mike. We've had plenty of rain, not nearly as hot as the rest of the country, so far I'm very happy to be in northern Wisconsin with happy cows and poultry.
The garden spot, it sounds like. All right, well, this is not a bad place to be either here in San Diego. Let's talk about your convention and really, I think, the role of veterinarians in food production today. And it's an increasingly critical role, and I think it's kind of an evolving role as well.
Yeah, I think veterinarians are pretty well known as taking care of individual animals, whether it's our pets or whether it's our livestock for food production. But really, veterinarians play an enormous role behind the scenes that most of the public doesn't understand as far as taking care of the animals and proper drug use. We want healthy animals available for our food supply, and then they're also involved all the way along from once they leave the farm all the way through production and into our homes. It's very important that we understand what a safe, affordable, nice, safe, abundant food supply we have in this country.
I often talk about, veterinarians, you're on the front lines. To me, you're the experts in the field. And so many of these issues we discussed today, and it seems like decisions are now being made about how we care for our animals without really talking to the experts, the people we ought to be checking with.
Yeah, I think that's true. I think as we become more urban, we get further and further removed from where our food is really produced. And so you're right. I think emotions many times and lack of knowledge for how our animals are raised and taken care of, so that when you actually get to that food from your grocery store, there's a lot that goes on, and veterinarians are right front and center at that. And I think I want to just reassure the public that veterinarians are directly involved with that whole process. And I know there's a lot of concern right now about whether there's medications being used here and there, but I can assure you veterinarians are involved in that whole process with producers so that antibiotics or any other medications that are used appropriately for treating sick animals or as a matter of control or even prevention of disease, and they're used very judiciously. Veterinarians really need to be involved in that process. The other thing I'll just add with that is that veterinarians are very actively involved also with Food and Drug Administration, which is so that we can make sure that we do have proper use and regulation of that use of medication. So it's, yeah.
Yeah, that partnership between the livestock producer and the veterinarian, that's a critical link in the food chain.
Yeah, it absolutely is. It's so critical, in fact, that I happen to be from Wisconsin, but there's a number of states that are working very hard on residue task forces to make sure that we develop that very good relationship with producers so that we're not each going our own ways, and that veterinarians are very actively involved with that whole process.
Let me talk to you a little bit about the career of being a veterinarian. We hear from time to time that there are shortages in some areas and hard to get people, are there job opportunities? What would you say to people, especially young people thinking about this as a career? Are there good opportunities out there?
Yeah, there is no question there's good opportunities. I think we're at a transition period right now. We've lost a lot of funding for higher education, and that raises the cost of the education. The problem with that is that then as any professional goes out into the workplace, they need to be able to earn back and take care of that educational debt and investment. The problem we have with livestock or food animal production is that those animals are usually raised in rural areas. There's not enough animals or people to support sometimes the expertise of those educated health professionals. So that's a problem, I think, in many professions, is getting those healthcare professionals to rural areas.
Yeah, where there is a great need, it may be hard to attract those young people to come and work and live in those areas.
Yeah, absolutely. But the AVMA has supported very strongly a repayment loan program, so that's been coordinated through funding from our Congress, but also through the USDA, so that they turn that needs assessment over to each state veterinarian, and they determine where these areas of needs are, depending on how many animals are there based on how many veterinarians are there. That allows us to accept applicants into that program so that they have an incentive to go to these rural areas, which has been very, very helpful and very, very successful. It's in its third year right now, so it's still a little bit early, but I think it's going to make a big difference in getting veterinarians to those areas of need.
That's great. You mentioned the urban society that kind of attracts more people to the bigger cities and maybe more of the small animal business, right?
Yeah, and I think that's an issue we have in our profession because many of our applicants still see our role models as companion animal practitioners in the city. There's no question about that. We're working very hard right now in a number of educational initiatives with the veterinary medical colleges and their programs to try and see where our assessments and our needs are so that we can get more exposure for veterinary students and applicants to understand the variety of career paths that they have in veterinary medicine.
Well, thank you very much. We always enjoy being at your convention, and share some of that rain that you have in northern Wisconsin with the rest of us, okay?
Yeah, you bet. Thank you so much, Mike, for having me.
That's Dr. Rene Carlson, president of the American Veterinary Medical Association. All right, one of the key issues, antibiotic use. We'll talk about that next. Stay with us on AgriTalk.